So this patient 64 presented with complaints, blah, 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 and deficiency anemia. All right, so hypertension, excellent performance status, sigmoid mass, biopsy, adeno. So he gets essentially taken to surgery as stage 3B, moderately differentiated adenocarcinoma of the colon. Okay, so had surgery, CA normalized, and the patient doesn't want to do adjuvant chemo. Okay, is there a role for ctDNA to assess evidence of microscopic? Yes. Well, I don't know if I want to convince the patient to do something that they don't want to do. Let me start with that. Unless the patient is open to the idea of chemotherapy, and then I'll tell you there are multiple elements here that complicate the discussion. One is, can this patient benefit from just a fluoropyrimidine? And the answer is yes, they can. Capecitabine single agent or 5-FU gives you about 50% additional improvement on the recurrence rate in absolute numbers. Oxaliplatin adds 3 to 4% to survival, to the 5-year survival. 5-FU cape 15%. So the first discussion I'd have with this patient is, well, if oxaliplatin is the problem, we can still proceed with fluoropyrimidine. At the same token, I do think that this is a patient that I would do circulating tumor DNA for many reasons, not just to convince the patient about adjuvant chemo or not. So first of all, let's take two scenarios. Circulating tumor DNA is negative. Then, the risk for this patient to have their cancer coming back is about 35%. I'm just guessing. But it's about that number. If MRD is negative, especially the tumor-informed MRD is negative, then you reduce the risk from 35 to 15%, because you have that 15% that you lose from the negative predictive value of the test. So you have 85% certainty that this patient will not have his cancer coming back. Only 15% chance it will, we think, right? So that improves the odds in some ways just by doing an MRD test and it's negative. If it's MRD positive, then you have 100% certainty this patient will have their cancer back. Now the question there becomes, does this patient benefit then from chemotherapy? The Circulate Japan study actually suggests that perhaps that these patients, may receive adjuvant chemotherapy and may ultimately do better. So maybe that can convince the patient a little bit closer to consider adjuvant chemotherapy. And if not, then you'll have a tool to follow up closely on recurrence. If the recurrence ends up being oligometastatic, you can act on it early. And so I see a lot of value for circulating tumor DNA here. Whether it's negative or positive, it can help. Whether we do adjuvant chemotherapy or not, it still has value.